Now let's come to hernia, a very common presentation in our part of the world, and people after build, either they're lifting weights or even if they are not, they have all sorts of hernias, inguinal and then incisional and then gastric. So can you mention the different kind of hernias, how common they are, why is it caused first, and then
so the most common hernias. So for the male gender is concerned, are the groin hernias, are we called as inguinal hernias.
Right.
So for the female gender is concerned, the most commonest hernia is umbilical or the paraumbilical hernia. So the reasons why males are having more inguinal hernias, because their routine work to carry heavy weight, heavy exercises, okay, these predispose them to have the groin hernia, and then the smoking, which is more found in the male gender in comparison with the female. So for the paraumbilical hernia or the umbilical hernia, it comes the matter of pregnancy. So you can understand.
Yes. Right. What about incisional hernias? Why do we have so many cases of incisional hernia?
Lot of reasons for the incisional hernia can be from the surgeon side as well. Surgical fault can be patient related factors. Let's say for suppose incisional hernia is we operated for something else, and then at that scar we are having hernia. So that is called as incisional hernia. That can be faulty surgical technique, and that can be because of some patient factors like obesity,
and loose
smoking,
muscles.
chronic cough, constipation.
So when we speak of this protrusion of the contents from inside to the outside, right? And they say that there is a chance that it might strangulate someday, and before that you need to fix it. So many people are, okay with it coming out and going in and hanging it, and they're having it hanging outside without realizing how dangerous is it. So can you please, stress on how early the diagnosis is better, and then getting it fixed. Either you remove it or you repair it or you put it in and then you seal that place. How important is that?
I mean, it should be fixed timely. Unnecessary delay should be avoided. If patient is operable, there is no contraindication for the anesthesia. He or she should get operated timely. Why? Because there are chances, like you mentioned, it can get obstructed, strangulated. Most of the times during coughing or sneezing, it can get obstructed, it can get strangulated. So the most common content in case of the groin hernia is the small intestine. Once it gets strangulated, it just arrests that loop of small intestine. Then it can turn into gangrene. Having the simple procedure where we just give nick, we just close the hole, then we place
mesh
on it to make it more strengthened. Then we have to cut off. Gangrene is part of the small intestine. We have to either bring it over the skin, or we have to suture it.
When we talk about mesh, are these meshes safe? Do they get infected? Is there any post-op care related to mesh? And how long does a mesh last? And how important is it to wear some kind of, truss or belt afterwards on the abdomen or that area?
Usually mesh, a good quality, a low weight mesh is usually advocated, and they are usually safe. But I mean, it's matter of sterilization again, and it is again matter of patient related factors, like how well he is following the advice of doctor after the surgery. And I mean to say, is she diabetic? She is running with the uncontrolled diabetes. These are the patient related factors that matter. So for the mesh infection is concerned, I have a 12 to 15 years of experience. I can say it confidently. Until now, I never found any of my patients get it infected. Hiatus hernia. I mean, there is a curtain which we call in medical terminology diaphragm, that separates your abdominal and chest cavity. Okay. Sometimes there is natural opening in that natural curtain in that diaphragm, that is called as hiatus. Sometimes that gets enlarged, then the esophagus and the stomach, they gets pulled up. then they are having symptoms just you mentioned. We just fix them laparoscopically.
Okay.
And if it is small hernia, which means it is less than 4 centimeter, we just suture it.
Okay.
Or at times, if it is more than 4 centimeter, we can place in a mesh there as well.
Okay.